Hi everyone, Dr. Williams here. I want to talk to you a little bit about your first case study. And so hopefully you just reviewed that case and you can see that it pertains to a client by the name of Mr. Coleman, who's a 21-year-old male and who's experiencing some distress. This particular case study is covering anxiety disorder. So before I go on, let me just tell you that if you're watching this video, you're going to have a leg up on this assignment because I'm going to explain some things that are going to help you and try to narrow it down for you as far as a diagnosis goes. If you don't watch this video, it might be a little harder for you. But first of all, the chapter in the DSM-5 that covers anxiety disorders covers several different ones. And just so you know, the DSM-5 groups, the chapters are such that disorders that are similar are grouped together. In the chapter about anxiety, it covers separation anxiety, selective mutism, specific phobia, social anxiety disorder, panic disorder, agoraphobia, generalized anxiety disorder, substance-induced anxiety disorder, and anxiety disorder due to a medical condition, other specific anxiety disorder, and unspecified anxiety disorder. That's a lot, right? So, for the case study with Mr. Coleman, I'm going to narrow it down for you. I want you to look only at 5 different ones. I want you to look at specific phobia, social anxiety disorder, panic disorder, agoraphobia, and generalized anxiety disorder. Because the diagnosis that you're going to arrive at is going to come from one of those. Now, the other ones that are described in that chapter, be sure that you read about them and that you have an understanding of what they are. So whenever you go down to part 4 of the assignment, after you watch this video, you're going to see that I have included a template for you for this case study. This template is already formatted to APA. You can use this template to help format your own paper. You'll see that in the template, the paragraphs that are there tell you what to include in each section. And at the end, I also give an explanation of how to use in-text citations correctly. So I hope that template will be helpful for you in structuring your paper and in writing your case study. So let's talk about that first section in the case study, which is going to be your rationale. This is going to be where you're going to explain how you think Mr. Coleman meets criteria for the diagnosis that you select for him. In this section, to get full credit, it's very important that you discuss at least one other disorder that you ruled out. And so that needs to be one of the disorders of those 5 that I've told you to look at. So of the 5, you'll select one, and then you'll talk about how you ruled out at least one of the other ones. In order to kind of know how to decide between this diagnosis and this diagnosis, each disorder has a section titled Differential Diagnosis. And that section is going to tell you how to look at this disorder versus another and how to rule one of them out, tell them apart, how are they different. That's going to be the section that you're going to need to look at for each disorder. Very quickly, it's important that we talk about panic attacks. Panic attack is not its own diagnosis. However, panic attack can be used as a specifier for any other mental health disorder. mental health diagnosis. So, for example, if you're going to use it as a specifier and you decide that your client has social anxiety disorder, when you document the diagnosis, you'll write it like this: social anxiety disorder with panic attacks. Okay? That's how you include a specifier at the end of a diagnosis. If you decide that Mr. Coleman has panic disorder, you're not going to use panic attack as a specifier, because that diagnosis, panic disorder, it already covers panic attacks. It's a given for panic disorder diagnosis that there's going to be panic attacks. So you would not say panic disorder with panic attacks. That's redundant. We need to talk about agoraphobia for just a minute. Okay, so agoraphobia is a condition where an individual is very afraid that if they go somewhere, that they're not going to be able to escape, or that there won't be help for them if something happens. So think about that person who goes to the movie theater and has to sit in the chair right by the exit just in case a fire breaks out, just in case something happens. This is going to be the person who, no matter where they go, they're going to be looking automatically for where are the exits, and they're going to be hovering very closely to them. And so when you think about agoraphobia, it's the idea of not being able to escape. It's the idea of not getting help if needed that causes that anxiety, and that will lead an individual to just avoid going places where they're afraid they might not be able to get out, like an elevator. Agoraphobia is its own diagnosis, can be its own diagnosis. And so if you read the case and you decide that Mr. Coleman has agoraphobia, but that's not the only thing he has. Let's say that you decide that he has social anxiety disorder. You would list social anxiety disorder and agoraphobia separately as separate diagnoses. So agoraphobia is not a specifier, it's its own diagnosis. So just know that as you complete this case study, you might come up with just one diagnosis for Mr. Coleman. If you decide he has agoraphobia, you might have 2 diagnoses. Or you might just have agoraphobia. Let's see here. What I want you to consider when you're trying to decide, what diagnosis is appropriate for Mr. Coleman is I want you to look at the length of time that he's been experiencing symptoms. I want you to think about, are panic attacks evident? And if panic attacks are evident, are they panic attacks that can be expected because there's an identifiable trigger for them? Or do the panic attacks come out of the blue? Are they unexpected? Those are going to be important things to consider. If you're trying to decide if a client has agoraphobia, it's really important to consider the source of the anxiety and the trigger for a panic attack. Again, if the fear of not being able to escape or not being able to get help is the source of the anxiety, then you would look at agoraphobia. But if a client is not necessarily fearful of the movie theater or fearful of an elevator, they're just maybe kind of worried that they might have an unexpected panic attack that might be embarrassing for them or something, then you probably would not be looking at agoraphobia. I hope that this information helps you. I look forward to reading your first case studies, and good luck, and I'll talk to you soon.